want to share with you a status update on where we are with the SNAP benefits situation. You hadn't received an update, a formal update from staff since I think it was the October 7th board meeting that Lissette presented to you all, and we committed to you and keep you informed. And since we have you here today, I thought it would be appropriate to give you a status update, particularly in light of the November 1st deadline approaching. Before I share this update with you, I want to thank Dr. Campbell, Yolanda Griffin, and Lissette, and some of the others that have provided this information to me while I was engaging with you during the retreat today. So just to level set, the U.S. Department of Agriculture has directed the North Carolina Department of Health and Human Services to suspend the issuance of November 2025 SNAP benefits, here known in North Carolina as Food and Nutrition Services, due to the ongoing federal government shutdown. Per the USDA memorandum, which is dated October 24th, 2025, the suspension of benefits does not affect the ongoing determination of eligibility of applicant households. Therefore, all counties are expected to continue normal operations for application intake and processing in accordance with federal and state policy. So what am I saying? The individuals should still apply for those benefits with respect of what is looming on November 1st. So how has what I shared with you, the aforementioned, been communicated to the public? A press release was issued on yesterday, October 27th. Also, direct text messages to these participants were sent as well. And then in addition to that, social media and traditional media outreach has been performed also. SNAP benefits are 100% federally funded, as you know. States are not permitted to issue benefits using state funds with the expectation of federal reimbursement. We, the county, are currently engaging with our community partners. This has been going on, started on yesterday, actually late last week. When we engaged, we notched up our engagement with our community partners and food resource organizations to mobilize a plan to help get food in the hands of families with acknowledgement that county doesn't have the resources to make up for the SNAP benefit freeze. Made that very clear back on October 7th. The North Carolina DHHS is meeting with our directors, our DSS directors. Yolanda will be attending that meeting tomorrow, and possibly Dr. Campbell as well. They're participating in those meetings to discuss strategies and also hear from our peer county directors in terms of how they're responding to what is going on. And then also, you recall, as shared with you on October 7th, our response will factor how the state is going to respond to what has happened at the federal level as well. So all of those discussions will occur tomorrow. At a minimum, we will expand our food pantry capacity with our partners. And the reality is, we will not have enough food to serve the 63,000 Mecklenburg County households that are receiving SNAP benefits. The cost to provide these families a 7-day supply of food boxes, the cost to provide this would be $2.8 million a week. That's nearly $3 million on a weekly basis. And as of September of 2025, the monthly value of SNAP benefits is $24 million. Hence why I say, again, no county in this state is in a position to supplement the funding associated with this benefit. So again, the monthly value as of September, $24.3 million, which breaks down to $175 per participant. There's a total of 138,460 participants that make up that 63,000 household number that I referenced. We anticipate having additional information and recommendations from these discussions by this Friday. Again, conversations with the state, our county peers will be occurring. I'm traveling to Raleigh tomorrow to attend NACO's Business of Counties session, so I'll be there with David, our Wake County manager, and he and I plan to have some discussions about how we're going to respond to this as well. I'll share that with the team accordingly. But I wanted to give you a status update on where we are with this. We are prepared to respond to any question that you may have, but I can assure you that just like the last update, that we are all in on this, taking it very seriously in light of the hand that we've been dealt relative to what we can and cannot do. So our efforts is not to supplant because we can't do that, but it's to try to minimize the impact, the blow that is associated with this. Now, of course, if there's a budget in place by November 1st, then we're at a good place. But if not, we're prepared to have a plan of action moving forward. And we'll continue to keep you abreast, more than likely at your meeting next week, Wednesday, because of Election Day. You'll probably get another update at that point of time as well, pending how things play out between now and November 1st. That includes my update on that item, Mr. Chair. Happy to take any questions.
So let me do this, because I know everyone is concerned about this, but let me set the stage real quick. One, the manager said there's a meeting tomorrow. Yolanda, Dr. Campbell may be a part of that as well. So we'll have more information at that point, which will be communicated to the manager. What I will make sure, obviously, the manager and I will be in communication. So I will make sure that I'm communicating to the board all the pertinent pieces that need to be communicated for awareness purposes. But I think two of the big takeaways that was said, we're not allowed, well, it's costly, number one, to try to supplant that level of funding that's supposed to come from the feds. There is no reimbursement for that as well. 63,000 people potentially impacted. And then we are also, I'm sorry?
Households.
63,000 households, excuse me. Thank you for that. And we're also coordinating with partners. And so my goal will be to communicate with this board to make sure that the community is continuously communicated to, so everyone is very clear on what our role is, what the plan is, and how we plan to impact this. But as I know information, I will send it out to us as board members. Obviously, that does not preclude anyone from reaching out to the manager directly, but I would just ask, as they're in those meetings, to not just arbitrarily let's pepper every communication. Let's allow them to get and gather as much as possible, because it may answer our questions. Mr. Rodriguez-McDowell.
Can you just help us understand what are some of the possible things that you're thinking of, or the manager's thinking of, when you say a plan, or what we might do, or how we might respond to this?
What I'm comfortable saying now, because I don't want to be committal, because we have to have these conversations with our partners. I'm sure you understand that. But the focus is partnering with our pantries. But even then,
with who?
Our food pantries.
Food pantries.
But
okay.
even then, they have a limited supply. When you talk about the number, the 63,000 households, and who knows how long this may last. But beyond that, I'm a little reluctant to say at this point.
Okay, thank you.
Commissioner Griffin.
Yeah, what I would hope, once you get that information with the chair on Friday, I think that's the 31st, November 1st is the next day, that whatever in big print on our website or whatever it is, that people have some idea in terms of continue to apply, or whatever the decision is, so people will have access to accurate information, as opposed to rumors, et cetera. And I'm sure that you and the chair and PIO and stuff like that will do that.
Yeah, I totally agree. When I was speaking with Yolanda during the break, we were talking about a communication strategy that, of course, includes working with Suzanne and her team.
Okay. Thank you.
Commissioner Powell.
Can you just repeat what the price was per week?
Yeah.
2.8 million.
It's 2.8 million. I can run down all the numbers
That's
for you.
okay. I didn't,
But the weekly is 2.8.
thank you. That's all.
Okay, thank you.